Hello everybody. I will now give you a brief introduction and overview of the consent process required to enroll patients into their cross study. So why is an informed consent process required in the first place? For one, it's an ethical requirement. Secondly, it's the law. If you enroll patients, collect data or blood samples from patients without prior written or at least verbal informed consent, you are actually committing a felony. Thirdly, and probably most importantly, it protects the rights, safety, and well-being of the participant. The consent process ensures that the participant knows what he or she is agreeing to, and it also ensures that he or she is agreeing to voluntarily. For the ACROSS study, all patients attending the hospital are screened. Patients that fit the inclusion criteria are offered to participate in the study. These patients are informed about the study objectives and procedures, the risks of participating, the benefits of participating, confidentiality, the sample collection process, what happens to the collected sample, and what happens with the generated data. All potential participants are also handed out an information sheet so that they can look up later on any additional information they require. Everybody who participates in the study must agree to participate and do this in written form. Parents must sign for minors, and children above the age of 11 years must provide assent in addition to consent provided by the parents. The participation is voluntary. On this slide on the right hand side you can see a sign that I saw in a shop a couple of weeks ago. This of course is rubbish and does not apply to our study. So participation is voluntary. Nobody can be forced to participate, and this is really crucial. People do not have to provide a reason why they do not want to participate. It is the patient's decision not to be part of the study, and the study team must accept this. The participant must also be assured that he or she can withdraw whenever they want to without having to fear any negative consequences. And finally, participants must know that they will be treated just as friendly and will be provided exactly the same service and treatment at the hospital when not participating or withdrawing the consent. The consent and assent must be informed. This means that the participant has the right to ask questions about the study, and he can do so as long as he or she wants to. Participants need to document their approval to participate by a signature. Now, there are some scenarios where a signature cannot be given. If a participant cannot write, he needs to document consent through his fingerprint in the presence of a witness. The witness then also needs to sign the consent form. Unconscious patients or patients who are in a temporary condition where it is doubtful that they understand the study cannot be enrolled. And this also applies to patients who, for example, might be under the influence of drugs or alcohol. Adult patients who are mentally impaired must have a legal guardian sign on their behalf. These patients, if possible, also need to fill in an assent form. I would also like to add a word on the consent and the assent process. So any child from the age of 12 years onwards will need to provide written informed consent, which in this case is called assent. This needs to happen in addition to the consent signed by the parent. It is quite possible that a parent would, for example, agree that the child should participate in the study, however the child refuses to. Again, in this case, no pressure can be exerted onto the child. The child has the right to refuse, and this needs to be accepted. But who can actually collect consent? This is the designated, probably medical staff from the study team appointed by the study coordinator, in this case Dr. Meifong. People who cannot collect consent are medical staff outside of the study team, study staff that has not had training on consenting beforehand, and study staff that is in a close personal relationship with the participant. Close relatives and friends of study staff can of course be enrolled. The only exception is that they cannot be consented by the person they know directly. This needs to happen by another person from the study team. What is extremely essential is that the participant must not feel pressured to consent at any point in time. How should the consenting process happen? First of all, make sure the participant is comfortable and you have enough time to address any questions the participant may have. Make sure that the consenting process happens in a secluded environment where there is no access to the public and there's no public traffic. The participant must not feel pressurized to agree to participate at any point in time. First of all, by the consenter. It happens quite often that especially people who are less well educated are fairly intimidated by a medical setting. And these people then tend to agree to a lot of things without asking critical questions. It is the consenter's role to make sure this does not happen. The participant or the potential participant feels safe and has the impression that he can ask as many questions as he wants to. It is also possible that other family members or friends exert unduly pressure onto the potential participant. If the consenter has the impression this might be the case, kindly ask family members and friends to leave the room and speak to the participant or the potential participant, in private. However, also the opposite scenario is possible. The participant seems intimidated and the consenter has the impression that he or she does not dare to ask questions. In this case, it often helps to offer the participant to include a friend or family member in the discussion. So once the potential participant feels comfortable, make sure you have enough time to address all questions and concerns. And make sure the participant understands. Some of the common misconceptions that have been encountered quite a lot are, for one, my treatment will not be as good if I don't participate. Ensure the participant that this is not the case. A second quite common phenomenon is that the participant will think, I have no idea what this person is talking about. However, I better just nod and agree and hope this goes away. Again, it is the duty of the consenter to make sure this does not happen. Another common misconception is that participants believe they will receive money or another benefit if they participate. This is not the case. There is no difference in risks or benefits in between participating or not participating in this study. A final word on confidentiality. First of all data and results collected during the study are confidential. And this really means you cannot talk to anybody outside the study team about these findings. You also cannot approach a participant outside the study setting and mention his or her participation. And it is your responsibility to ensure that all data collected is only visible and accessible to study team members. Whenever you are in doubt about any of the data questions, always refer to the principal investigator, Dr. Mei Fong, for advice before handing out any data and results. To ensure confidentiality, the study will not work with clear names. Instead, each participant will be assigned a unique study ID number. For Laos, this study ID number starts with a 7 and is then followed by a 4-digit number in sequential manner. It is quite essential that each study ID is only assigned one time. If in doubt, it's no problem to skip a number. However, just make sure there's no duplicate study IDs. A list with clear names and assigned study IDs is also kept and must be kept under lock and key at all times, ideally by the local chief investigator, Dr. Mei Fong. And this is the end of the presentation on the consent process. Thank you very much for your attention.